Across the country, the demand for nurses is rising. Federal data predicts we'll face a shortage of more than 200,000 registered nurses in roughly the next decade. National investigative reporter Andy Parati looks at the way shortages are being blamed for lapses in patient care. One new lawsuit accuses a hospital of not doing enough to keep a patient alive. I want to give a warning to our viewers here. This story does discuss suicide.
Savannah police respond to a call inside an emergency room in 2024.
So he was like hanging, like his body was like this.
Do you know who initially made that call to security?
Inside this bathroom, a man found hanging from his hospital gown. His name, Michael Sheridan.
I was with him. I was holding him. I had said to the doctor,
Carol is Michael's mom.
I said, "Doctor, how could this happen?" And he said to me, "I don't know." He says, "I don't know."
Before he arrived at Memorial Health University Medical Center, he called 911 from this hotel, begging for help.
Chatham 911, where's your emergency?
Hi, how you doing? I'm having a nervous breakdown.
It happened when the 35-year-old New Yorker stopped in Savannah on his way to visit family in Florida. Diagnosed with bipolar disorder in his 20s, he recognized he was having a mental health crisis.
I'm having suicidal thoughts. I don't know what I'm doing. Please help me, please.
According to a pending lawsuit, when he arrived at the hospital, staff did not help Michael when he needed it the most, claiming they left him unsupervised when psychiatric patients are supposed to be monitored at all times. According to a police report, Michael was seen carrying multiple gowns into the ER bathroom, locking it from the inside. Security forced the breakdown to get inside.
I got there and I'm like, "How long's it been in there?" They said, "Like about 30 minutes. I'm like, "What?" I said, "Why are they just not calling us?"
The lawsuit claims when Michael went to the hospital, he should have been taken to a section of the ER reserved for psychiatric patients to wait for a mental health professional, but the ward was closed.
What was the reason for it being closed? You remember?
Staffing.
Staffing.
And he was the only
thing that we had
outside the department.
Natalie Woodward is the family's attorney.
What does that mean to you?
To me, it means they didn't have enough nurses to operate that unit. This was something where it was just so preventable and easily preventable.
Memorial Hospital declined interview requests, but in a prepared statement wrote, "The loss of a loved one is devastating, and our thoughts remain with this patient's family and friends. We're aware of the filing, which we are reviewing, and we will respond through the legal process." While the hospital did not acknowledge if it experienced staffing issues the day Michael died, Georgia is among one of the top 10 states with the largest projected registered nurse shortages. According to the National Center for Health Workforce, these 10 states are on track to face shortages of RNs between 17 and 22% by 2037. The number of nurses that would be needed to fill the gap in these states, 194,000.
I could tell that he was pretty anxious.
A young man crying out for help in a hospital accused of not having enough staff to keep him safe.
I'm having a nervous breakdown. I'm having a nervous breakdown. I need psychiatric help, please.
For KY3, I'm Andy Parati.
Well, the hospital and health system responded to the allegations in court in late June. They deny any negligence. We reached out to local hospitals to see what they're doing to stay ahead of the nursing shortage, and all agree education is key. Cox Health Senior Vice President Bev Polifka says the nursing shortage isn't a surprise. That's because of two things. The aging baby boomer population needs more care, and there are fewer nurses in the workforce. She also says the pandemic accelerated some of that shortage. Meantime, she told us Missouri is doing better than the rest of the nation with both vacancy for registered nurses and turnover rates. Cox Health, we're told, is in the 90th percentile in the country for vacancies and turnover rates. We're told Missouri's emphasis in workforce development and education has helped the state. Polifka points to Cox's Alliance for Healthcare Education as another tool to help.
We've pulled together not only Cox Health, but pulling together with MSU, OTC, Springfield Public Schools, because we know that we have the ability by coming together to solve and really mitigate the workforce challenges coming in healthcare.
Mercy Hospital is also seeing favorable numbers when compared to the country. Jessica Atkinson with Mercy says fewer nurses have left over the past 3 years. Mercy has also expanded its educational programs, and collaborations with local universities have allowed students and staff a more hands-on learning experience.
That allows a Mercy coworker who's a nurse to work as an adjunct faculty for the academic program. So it gives real-world hands-on experience to those students that is different than someone who's only ever worked in academics providing them a clinical experience. It's the people that are giving the care every day that's doing it.
Now, we also heard from Citizens Memorial Hospital in Bolivar. They told us applicants are sparse, but they have placed a strategic focus on collaborating with nursing programs and in professional development. Nice look.